I mean, you think about it, you're having a migraine more than 15 days out of a month, that's half the month. And some can go the whole month, you know?
Hey everybody, I'm Dr. Sanjay Gupta, and I'm very excited today to be joined by Dr. Smith to chat about an important topic, something that I am personally very interested in and affected by, and that is migraines, specifically chronic migraines. One of the things that has always struck me in the conversation about migraines is that they're automatically characterized just as bad headaches. They're really something very different, right?
They really are, absolutely. Much more severe than just a headache. You know, they're so much more debilitating than just a headache. And it's important to make that distinction.
I really suffered with these things. And one of the questions that came up over and over again was, what is the difference between chronic migraines and episodic migraines?
These are migraines that people have that go anywhere between 0 and 14 days per month. But once you get to the 15 or more days per month, and at least 8 of those days within those 15 or more days have to include a feature such as an aura, something like that, for more than 3 months to classify as a chronic migraine. And these patients really get disabled from them. I mean, you think about it, you're having a migraine more than 15 days out of a month, that's half the month. And some can go the whole month, you know?
For people out there who they listen to you, okay, 0 to 14 days, they're not exactly sure where their migraine experience would fall on the spectrum of episodic or chronic. What kind of advice do you give people?
Keep a headache diary. You know, you can write this down with a pen and paper, or you can just use your cell phone nowadays. What it does, it allows you to track your symptoms and the frequency that you're having these symptoms, so that when you go to your doctor, the doctor will have a full picture of what your migraine attacks look like, what the symptoms are, and you can distinguish whether or not they're episodic or whether or not they're chronic. You want to know whether or not your migraine attacks are increasing. You know, they started out maybe 3 days a month, but now you're getting 10 days a month. And then you cross over into that 15 or more days a month. If that number is going up, you know, it's very important to document that and then go to your healthcare provider and or your migraine specialist.
If you are reaching for medications, and sometimes that can be challenging to figure out what's going to work, but if you are reaching for that bottle of medicine more and more, or tracking through your own diary 15 or more migraines per month, that's a sign then that those episodic migraines have progressed to being more chronic?
It is. And once you've gotten that information, you know, you talk to your doctor about any preventative treatments that you can take. These are medications or medicines that you can take to actually stop the migraine from happening, rather than taking a medicine that's just going to stop the symptom once the migraine has already started. So it's very important that you take care of yourself, that you eat well, you exercise, you stay hydrated. You just don't want to let your migraines totally isolate you.
Well, look, I appreciate this, and I know that there's a lot of people out there who struggle with this, and you're absolutely right, I think, about that last point, Dr. Smith. So, Dr. Smith, thanks so much for your time. Really appreciate it.